Good evening. Welcome to the HCH presentation on autism and Heilkunst, a discussion. The purpose of this evening is really to allow parents of autistic children or those children on the spectrum that are being treated or want to know more about this particular system of treatment that we call Heilkunst, to give them an opportunity to ask questions, but hopefully provide answers for those. Before we start, I'll just give a brief introduction. My name is Rudi Verspoor. I'm the director of the Hahnemann Clinic for Heilkunst. I'm a director with the Hahnemann College for Heilkunst. Both of those institutions are set up under not-for-profit charitable organization established under federal law. And we provide treatment as well as education for those who wish to become practitioners in the system. We have a website, very simple, www.apathy.com, and that will give you all the information. The focus tonight is on autism. Autism for us is not a disease, it's a condition, a complex condition. We often read articles about questions as to the cause of autism. What caused autism? Why do we have this epidemic, seeming epidemic of autistic condition? Well, there are many underlying causes of autism, and no two cases really are the same. There are certain factors, of course, that can find in common in many of these cases, but there are also factors and aspects that are very different. And like any complex condition, there are many, many approaches to try to resolve this condition. With Heilkunst, we focus mostly on trying to identify and eliminate the underlying causes, as we call it, of the problem. And that is individual in each case. However, there can be commonalities, various shocks and traumas, birth traumas, drug traumas, even vaccination shocks, etc., that can trigger this kind of a condition in a child. The idea is that once you remove these underlying causes, that the symptoms that we associate with the autistic condition ameliorate, they improve, and eventually go away. Now, again, every case is unique. Each case requires a particular approach, and it's not always easy to determine how long it takes to get to that point. In some cases, it happens quite quickly. In other cases, it can take quite a while. Those who have been following this approach, this treatment approach, often have various questions about it. As you go along, of course, you learn more and more, but there are lots of common questions, and so we thought it would be useful to do this in a public way so that we can answer these questions, and this would then allow others to get these answers, so basically provide information for more people that might be watching tonight or be involved in tonight. So I'm basically open to questions. I think for those who've signed up, you've received the instructions as to how to do that. You just have to post a question, and once I see the question, then I can answer that question. And I don't see any questions on there yet. I'm not sure if there can be any questions. I have a number of questions that people had asked, or even things that I know that people have asked in the past. There's a number of issues that we address with patients over and over again. One of those questions is, can we do other treatments or therapies while we're going through Hopkins treatment? The answer is generally yes. Obviously, we would prefer if there were no drug drugs given, but in some cases these children are already on drugs and you can't immediately remove those drugs until they get better. But treatment can still take place even though someone is on drugs. Had one case, a very difficult case, where the child was on it was basically on 8 or 9 different drugs, but 3 of the drugs the doctor said that he could never get off of. But after roughly about 2 years of treatment, we were able to take him off those drugs as well. I see that we have a question here. I'm just going to select it. What does Heilkunst do when there are certain gene mutations present, like the MTHFR, VDR, or COMT, since these are known to forever affect patient? Well, the whole question of gene mutations is an interesting one. This takes us into, you could say, a revolution in biology that's taken place over the last 20 or 30 years. It used to be thought that everything was fixed in the genes, and once you had a genetic problem, a genetic mutation, and that was it. There's nothing you could do about that. But more modern research has started to show, this is in the area of what's called epigenetics, has started to show that it's the signals, the environment within which the genes operate, including the mutations, that really dictates whether a gene is able to express itself. So certainly more modern research is showing that if you can change the environment, you can do that in many ways. You can do that through diet, you can do that through meditation, you can do it through removing underlying blockages that are affecting the environment within which the genes operate. You can actually mute the gene, and in some cases turn it off. Not that you actually turn it off, but the gene isn't able to activate itself simply because there are other signals that are interfering with it. So with Heilkunst, we can't change the mutation. That, of course, is a given, but you can definitely change the impact of that mutation on a child, so that it acts as if it wasn't there, and that's entirely possible. Okay. Second question, what are your thoughts on dietary restrictions? For example, GAFCF diet, SCD, etc. Yes. First of all, when people come to us, they're already usually on some kind of diet. And there are lots of, you could say, good diets out there in the sense of the principles behind them. Gluten-free, casein-free, specific carbohydrate diet, the GAPS diet, etc. They all have a certain level of success. Our approach is basically, we don't recommend a strict dietary regime, mainly because by the time you get to us, you've already figured out, in many cases, what works and what doesn't work for your child. We do have our own approach to diet, and generally that approach is that a strict diet for these kids normally can only go so far. That you can moderate symptoms, you can deal with some acute situations, obviously, if they're eating foods that are causing or triggering various inflammatory reactions. You don't want to be eating those. But even in those cases where the diets seem to have helped, they can only go so far. I have many cases where the diets didn't help at all, and they went on strict diets for many years. And these diets are not easy to do. They're very, very difficult. Take up a lot of time and effort, and children aren't always compliant with that. And yet, after all that effort, nothing really changed, or things didn't change that much. So our focus really is to make sure that what you're doing on the dietary side is getting rid of the obvious problems. But we don't insist on a strict diet simply because in these children the problem mostly lies elsewhere. The diet is just a factor, and if you eliminate the most obvious trigger, you don't need a strict diet. you need it as strict as you can in the sense of eliminating the obvious things like often gluten, sugars, dairy products, you know, the usual triggers, and providing positive, healthy foods. This can be done under many of those diets. But we don't insist on a strict diet simply because the solution is going to come elsewhere. And that is by removing those underlying factors, underlying causes. Once you do that, we discover that people can go off the strict diet. Usually this can occur within 3 to 6 months in most cases, that you start to see that the child is healthier, they can tolerate more, they're able to eat things that previously they couldn't eat, or in many cases the children won't eat various foods because they don't like it, or they themselves react to them. But suddenly they're able to eat these foods and tolerate them, and their interest in food, the choice of food, improves and expands. Can you explain what a miasm is, and when do you know that a child doing rounds of miasm is done? Is it when he or she ceases to have miasmatic expressions? Well, a miasm is an old 18th, 19th century medical term for noxious influence. It was thought that there was something in the air, like from a swamp. Malaria used to be associated with swamps. In fact, it is, because mosquitoes breed in the swamps. But there's also this idea that there was something in the air that you breathed in that could affect you. In our system, we refer to a miasm as a particular kind of disease. It's a disease. Measles is a miasm, for example, an acute miasm. Mumps is an acute miasm. But there are also what we call chronic miasms. These are disease patterns or archetypal patterns that a person brings into this world with them. And these have various weaknesses. For example, the malaria miasm. This is something that, even if you've never had malaria, been exposed to malaria in this lifetime, you could actually bring with you into this world a malarial miasm. That is an underlying weakness that causes problems with your liver, cause problems with digestion. You could have a tubercular miasm, which can cause problems with the lungs, the whole upper respiratory system, and also digestion, etc. So there's 8 of these chronic miasms, as we call them, and we treat for those. Everyone has them to some degree or other. There may be occasionally cases where people don't have one or other miasm, but basically everyone has them. Lyme is another miasm, for example, and this is something that is now recognized as being endemic in North America, not just in its acute form. You may never have been bitten by a tick or whatever, but you could still carry this Lyme miasmatic influence, this kind of inherited archetypal influence. For us, it would be impossible to help these children without treating for the miasms, because the roots of their problems go very deep. That's why they are so easily destabilized by all the modern interventions. There are many kids that aren't, but these children that are destabilized, they're the ones that come into this world quite weak already to begin with. Now, that's not always obvious. The APGAR score could be very high, etc. Underneath, there's various weaknesses. It's like a scratch in a piece of glass, and you apply pressure to that, something's going to crack. So we need to treat for those. Now, how do we know when they're ready? Well, this is an assessment that the practitioner has to make. There's no hard and fast rule. We have protocols, we have a particular sequence that we use, we have ways of assessing when it's time to move on, and we have ways of identifying whether that miasmatic influence is gone or it's still there. So this is an assessment that the practitioner has to make. But it's generally fairly readily done, and there can be some residual influences from these miasms, but you just keep treating for it, and eventually it stops. It's just not there anymore. Now, each of these miasms also has a particular season associated with it. So right now, what we call the malarial miasm. The end of October, most of November is related to this malarial influence, and there are certain characteristic symptoms that can show up. And most people often get sick in certain seasons more than others, or feel a negative effect. But once you clear the miasms, you don't have that anymore. Is there a constitutional type that is more vulnerable to autism? Not that I've seen. You can pretty well see all of the different constitutional types, as we call them, or types. I think it's not the constitutional type that dictates whether you can get into this autistic condition, but more the influence of the chronic miasms, these inherited archetypal disease patterns. If you have them to a large degree, then you're more likely to be affected by drugs, by birth trauma, by interventions, by ultrasounds, by emotional shocks or traumas at any point in the lifetime. So this is what knocks you into this complex condition called autism. Autism is a word that comes originally when it was first discovered clinically back in the 1940s, mostly in adults. It was a word that simply meant withdrawal into the self. So I prefer to call it post-traumatic stress syndrome. I know most people associate this with wartime and soldiers and those kinds of very horrific situations, but in many ways are going through a kind of warfare in respect of the modern medical system and the interventions. While they, in many cases, you could say they can be beneficial, the problem is that they create a shock or trauma to the system, whether intended or otherwise. And for children who are already, in a sense, weak or susceptible as a result of kind of hidden weaknesses through the chronic miasms, they're more likely to get triggered and go into a kind of shock. So when you go into shock, you withdraw. You pull away. The world is not seen as a safe place. And so autism is just a kind of a Latin word for this withdrawal, this post-traumatic stress syndrome. And our society is so interventionist now that it's not surprising that this is happening more and more in many ways. If I start treatment for my child, how long before I see any improvement? Well, this is a question everybody asks, and it's difficult to answer simply because every case is different, but what I can do is give you sort of averages. In our experience with thousands of cases, I would say that within 1 to 3 months, almost all cases report some small improvement or larger improvement, but there's definitely signs that things are improving, that things are shifting. That doesn't mean there aren't issues there aren't problems to be dealt with, but in terms of the assessment, you can start to see that things are shifting. I had one mother put it very well the other day, and she said after many years of other treatments and diet changes and seeking different therapies, after 3 months of treatment, she finally felt that her child had been put back on track, put back on the right track to recovery. And that's a very good way of putting it. This idea that instead of trying to treat the symptoms, instead of acting like a fire brigade to get rid of this symptom or get rid of that symptom, you're more focused on why are those symptoms there? What's the underlying cause of these symptoms? Or what are the underlying causes? Because obviously there's a number of causes, not just one. And once you start to treat for those, you suddenly see that things start to move in the right direction, and that there is this steady progression of improvement, strengthening. The symptoms start to moderate, the overall health improves, the physical state improves, the mental emotional state improves. So normally the early improvement starts about 1 to 3 months. Then we start building on that. between months and a year, we can usually start looking at changes in the dietary plan, changes in supplements. Many of these cases that we get are already on a large number of supplements, or they had been. And these aren't necessary once the child starts to improve. So between 6 to 8 months, certainly up to 12 months, we can start to discuss the supplements and discuss which ones likely are not needed anymore, which ones are optional, and which ones still seem to be well indicated. But generally speaking, you can start to reduce. One case I remember had over 300 supplements. It's a 12-page document with all the supplements this child was taking. Within a year, we were able to reduce this down to about a dozen. And so our approach with supplements is very simple, similar to diet, is that there are certain supplements you need, but supplements, in most cases, generally are a crutch. They're a short-term measure. They only mask the symptom. They don't get rid of the underlying problem. A good example would be vitamin B12 injections. It may be that there's something wrong with the B12 function, and that can be part of the whole methylation problem as well. But simply injecting massive doses of B12 to flood the system doesn't solve the problem of why the body's B12 metabolic function is not where it should be. But when we start removing some of these blockages and also treat for the metabolic function itself a little more directly, then they don't need the B12 injections, and you can eventually let go of those. So the improvement is pretty good over that 6 to 12 months. Now, there are some cases, no question, very difficult cases, where it doesn't follow that. I've had to tell some parents might take a year or 2 years to see some improvements. And so you have to have a certain trust in the process and the logic of the process to do that. I think the worst case I had, it took almost 2.5 years to see good progress. But the mother was being treated at the same time, and she was noticing progress in her case, so she knew that something was going on. It's just that the case was so difficult. This was a typical case of a non-responder. Nothing else had worked in this case. This child was already 8 or 9 years old. And so, you know, even for us, it was very difficult. But once we cracked the nut, then things started to move. Even then, it took us a good 5 or 6 years to get that child to a very good place. So, in most cases, 1 to 3 months. Sometimes takes a bit longer, 6 to 8 months, but that's generally more the exception than the rule. Can you address mitochondrial dysfunction? I know ridding the body of toxins and shocks will likely make it easier for mitochondria to function, but I would also like to know if Heilkunst can actually repair the damage that has been already done. Well, this is a big question. It used to be thought that the nerves could never regenerate. You know, once you damage the nerves, that was it. But we're now finding that even though nerves regenerate slowly, they can regenerate. I've seen this with treatment. I have treated cases where people had nerve damage, and we were able to restore the nerves function, you could say, and get rid of the damage. Mitochondrial damage is there, yes, but the science isn't quite there yet, but it's suggesting that even with mitochondrial damage, it can be repaired and restored. So that makes sense to us. Any part of the body has the capacity for correcting the damage if the right tools are given to it. Our experience is that if we remove all these underlying blockages that are interfering with necessary function, then that natural repair capacity of the body will kick in. Now, I can't cite scientific evidence. We don't have the labs and the ability to prove this, but I know from our own experience in treatment that it's, in my view, possible. I don't see any reason you can't correct the mitochondrial damage and get the body to restore this function. Now, that doesn't mean it'll be 100% perfect, but again, definitely there's a large inherent capacity in the body to restore damage. We tend to think of the body in a very static way. But if you get a cut, if you break a bone, the body's natural healing capacity goes in. The cut heals itself, the bone heals itself. You know, we're used to this at the larger level, but there's no reason why this can't happen at the microscopic level in terms of the mitochondria or cellular function or any other kind of function. So it's definitely possible. Could you explain Heilkunst versus CEASE? Well, CEASE is an approach, I think it's has a different name now, Inspiring Homeopathy. But CEASE is an approach that partly borrowed from the work that, I don't know if they borrowed it from us, borrowed it from the doctor who started it, and we actually borrowed it from Dr. Elmiger in Switzerland, the idea of treating sequentially for various shocks and traumas. They use a different approach, however. We've had a number of cases that have been treated by this, and it didn't seem to work when they did it, but when we used our approach, it worked. As best I can tell, ours is much more comprehensive. It has more of a sequential logic to it, but it also covers many more things than is covered by the CEASE approach. Also, they don't tend to treat for the miasms in a systematic way the way we do. So they obviously will get some results, and maybe good results in cases, but the more difficult the case, the more comprehensive the approach has to be, the deeper you have to go. And that certainly is what Heilkunst offers. I haven't seen any other system out there, although they may have different features. I'm aware of other people who are using different features of it, but I've never seen anyone use it as comprehensively, other than, of course, those people who've gone to our college, Hahnemann College for Heilkunst, and trained and use our techniques. And we do have other good practitioners out there who are now using our approach and getting very good results. Do we have to stop all the other things we are doing for our child? No, generally speaking, if you're doing something, whether it's dietary supplements, drugs, different therapies, hyperbaric oxygen, ABA, sun program, any of these other things, essential oils, for example, all these things can continue. We actually prefer, at least in the first 3 months, that you maintain your normal routine or the normal treatment that you had been doing in other areas, so that we can have a baseline. If we start to see progress, and usually, as I said, we'll start to see that within a couple of months, we can start looking at, usually after about the 3rd month, we can start looking at reducing some of these if they're not necessary. But if you feel that they're beneficial or the child wants to continue with these things, they certainly don't interfere with what we're doing. So you don't have to stop or give up anything that you're doing otherwise. And then we can, as we go along, as to whether this is still necessary. What basic essential oils can be used and not negate the homeopathic healing process? Well, maybe the easier question is, which one shouldn't be used? Well, any essential oil can be. The remedies that we use work at an entirely different level. They're not going to be interfered with by what you eat, essential oils, other therapies, even other energy medicine. Some people might get treatment on a Rife machine, if you know what that is. I'm not going to explain it now, but some people do that. You might get other kinds of energetic treatment. I know some people get treatment through remote energy workers, etc. All of that, as long as we're aware of it so we can take it into account, is fine. you can use any essential oils you want to. They can be beneficial, and they only work at a certain level in a supportive way, but that definitely can be useful, and you might find it calms the child, etc. Because we're working at a much deeper level, none of these things really interfere with what we're doing. Okay, I don't see any other questions at this point. Basically, our objective is to work with you. We prefer to, take into account your views. It's your child. You know the child better than we do. We know what our treatment should do, and we're responsible for assessing and interpreting what's going on and providing our best advice in that regard. But we like the feedback. If you have questions, if there's any of the treatment process that you're not sure about, you're confused about, we're more than happy to answer your questions. We don't like to bore you with a lot of detail because not everybody wants to hear that, but definitely if you want to know something, we'll give you our best answer. That doesn't mean we know everything. It doesn't mean everything is 100% certain. Medicine is really as much an art as a science, maybe 80% science and 20% art. So there are still many open questions, and we don't have 100% certainty on everything, but we will give our best assessment of any situation and our best advice. Can you talk about the healing reactions that we see so far as regressions and how long it should last? Well, there are two types of healing reactions, you could say. And again, well, first I should stop and explain there are two sides of the. There's the side we don't like and the side we like. The side we don't like is what we term negative symptoms. This can be in the form of an aggravation, seemingly, of existing symptoms. Let's say a skin rash gets worse. It can be a return of old symptoms. So let's say the child had a skin rash a couple of years ago. It went away as a result of diet or herbs or essential oils or some other kind of treatments that you were doing. And now seemingly it comes back. And that's another negative, usually, seen by the parent, of course, not negative for us, and I'll explain that in a minute. But the third one is new symptoms. Symptoms the child's never had before may pop up. So this is the negative side of the healing reaction, which we don't like, because we normally associate disease or illness with those kinds of symptoms. With stool, fever, digestive problems, skin rash, behavioral issues, stimming, irritability, sleep disturbance. All of these things are possible on the negative side. But the positive side is the part we like. We start to see gains, better eye contact, more behavior, more cooperative, more language, a whole host of different things. But this is all part of the healing process, the healing reaction. Normally, when we say healing reaction, of course, we're talking about the negative side because that's what we're concerned about. But there are two types of the negative healing reaction. There's the short term, which is what mostly happens, and that is you give a remedy, a clear for a particular shock or trauma, and then anywhere from 5 to 10 days after that, sometimes sooner, sometimes later, but usually within 5 to 10 days, get these negative symptoms. Usually they last 1 to 3 days. They might linger for up to 5 days, but that generally is fairly low key. Sometimes you can get a symptom emerging that persists. I'll give you a very good example of this. I had one child who had a lot of problems with asthma, allergies, environmental sensitivities. Tried to treat him. He was on Benadryl, had tried different drugs, antibiotics, etc. Nothing seemed to be working. It was just getting worse. When we started treatment, we got down to a particular, I think it was the first vaccination that the child had had, and the ear opened up and started to drain this very foul-smelling, you could say earwax or pus coming out. Now that persisted for about 3 or 4 months until we got to the first vaccination this child had received, which was a tuberculosis vaccination. It's not a common one in North America, but this child was born in Brazil, where it's very common. And the tuberculosis vaccination is quite a shock to young children. But when we cleared for that vaccination shock, the ear discharge stopped within a week or 2 and never came back. But this was a case of a symptom that persisted, but it persisted because it was associated with something much deeper. So you can have certain, so they say, return of old symptoms, seeming exacerbation of an existing one, or a new symptom even, that can persist for some time. This is not the acute form, is more of a chronic healing reaction. It's good, it's positive, it's draining, it's getting rid of stuff, and you need to allow that to happen. If there's issues about intensity, discomfort, pain, or whatever, we will try to intervene, moderate that, or speed it up to the extent we can. But you should be aware that some of these symptoms sometimes can persist for some time. Why do most autistic children have high doses of heavy metals? And can chelation help? And can we do this at the same time as Hopkins? Well, chelation, the body has a natural form of chelation. It does it on its own all the time. The problem is, of course, in these kids and many others, that process isn't working. So it may need some support. And there are 2 ways of chelating. One is physical and the other is energetic. We can have remedies that promote the whole chelation function in the body. We can also specifically help the body chelate, get rid of heavy metals. On the other hand, if you want to do a physical kind of chelation, that's fine. The only thing that we caution against is that you don't do it too aggressively. This goes to the first part of the question: why are the heavy metals in these children? Our view is the following, and it's a little controversial, I suspect, but based on our own experience and principles, that the heavy metals in these children isn't just coming from the environment, from the vaccinations, from the air, the food, the water, etc. For some reason, these children have higher levels of heavy metals than other people in the same environment, receiving the same kinds of treatments. In some way, the body has the capacity to produce these heavy metals, but there's a difference between an organic heavy metal and an inorganic heavy metal. I'll give you a very simple example that illustrates this. A young lady in her mid-20s came to see us. She was very distressed because they had done blood tests or something else as a result of some depression that she had. And they discovered that she had abnormally high levels of mercury in her blood, in her system, but in her blood too, which is usually quite remarkable. And they didn't know how it got there. She didn't have any mercury in her teeth. She had not really been vaccinated other than as a child. And there was no environmental exposure that they could figure out. And yet she had these high levels of mercury. We looked at the case and simply started treating for the shocks and traumas that she'd had, and one of the traumas she'd had was a very severe emotional trauma. And when we treated for that, and we also supplied some remedies to try to chelate the mercury as much as possible, to the extent the body was ready to do that, and within about 3 or 4 months, the mercury disappeared. Now, first of all, where did it come from? Nobody knew. And then where did it go? Some of it came out in the usual ways, but a large part of it, the body simply converted internally. So these children have these, for us, mercury, for example, lead, these are energetic remedies. And in our view, this is a kind of crude attempt on the part of the body to try to create something, trigger something. So if we can get the reason why the body thinks it needs mercury and lead, organic mercury or lead, which in our view is not that dangerous. It's the inorganic mercury, lead, aluminum, etc. that you want to get rid of. Then it will disappear on its own. And usually in the cases we treat, that's what happens. The other thing is you want to be careful you don't force the body to give this up. I've seen a lot of stress imposed on children as a result of trying to force chelation. When the body's ready to let go of it, it'll let go of it. But if you try to force it, you create further stress. I've had to treat a few cases for the stress of chelation. Normally that's not necessary, but in these cases it was done too aggressively. What do you suggest we can do to prevent autism from developing in new babies? Any preconception, pregnancy, or birth advice? Well, a terrible topic in and of itself. The whole process from conception to birth in our society is done the wrong way. The whole conditions under which it's done. We're so medically oriented that something as natural as birth has become a medical procedure. Basically at all the different steps. Something like a natural birth without any medical intervention is pretty rare. Now, often the health of the mother is the problem. Ideally, we would treat the parents for a year or two, at least before they decide to have a baby. This would definitely reduce the chances of autism. Any problems or issues that occur in pregnancy, if we could treat that with homeopathic energetic medicine, then that would avoid a lot of the interventions that are necessary. We've done this in many, many cases. We can supply remedies for the whole birth process to make it much easier, so that if there's problems with labor, delayed labor or ineffectual labor, etc., they're very, very good remedies that can help promote that. Now, that doesn't mean it always works. Sometimes there's some deep problems that require intervention. But in the vast majority of cases, you could avoid all those interventions. And that would definitely make the child a lot healthier. The other thing that would help is, even if you didn't do the treatment to the point of birth, if right afterwards you came to us, we could treat for all of those traumas and remove the drug effect, the Pitocin for the induction, etc. All of that, even with the C-section, there's trauma involved. So we can remove those very quickly, and this then improves the overall health of the child, more resistant. And then, of course, if you could avoid vaccinations, certainly very early on, certainly right after birth, the child's immune system is really not functioning at any level within the first 6 months. It's operating off of the mother's immune system. And even up to the age of 2, it's more or less undeveloped. So providing vaccinations, which are recognized in the medical literature as being stressful to the immune system, actually even compromise the immune system. So in all the literature for vaccinations, it says do not give to a child if their immune system is compromised. And that could mean a simple thing like having a cold. Of course, most times they tend to ignore this and do it anyway because they have a schedule. But the more you could delay the vaccinations, the better. Ideally, no vaccinations, and seek to immunize in others. We provide this as well energetically. But the fewer interventions you can do in terms of shocks or traumas to the system, the less likely you're going to have an autistic condition. I have many cases where one child went the usual route and ended up autistic, and the second child was sort of heading there, but the mother, from the experience of the first child, delayed or avoided vaccinations and other interventions, antibiotics, etc., and sought other routes. And that child, while they had health problems, did not end up in the autistic category. Now, again, all it means is with autism is that you have a child with health problems, but the interventions, the shocks and traumas, flip them over into a more severe state, which we then give the label autism. But in my view, there's not much different between a child who has gut issues and environmental sensitivities, etc., but he's not classified as autistic. It's just a label to depending on where you are on a continuum. But it's just for us, it's a matter of a health problem, and how deep is that health problem? Well, when you're dealing with autistic children, it's usually pretty deep. But again, the fewer interventions you can have, the better. The healthier the parents are, the better. And all of that certainly can be addressed, but most of the time it's addressed after the fact. Okay, I see we're don't have any more questions at this point. We have just to let people know, for our patients, it's a private group, but we do have a Facebook group where parents can post questions and learn from each other, and also get feedback from us. It's a nice way of sharing, helping parents to deal with things that are fairly new to them, like the healing reaction, how to give the remedies, how do you tell, etc. Many of these things, it's a bit of a learning process, but usually within 3 to 6 months you have a pretty good idea of what's going on, and you have more of a comfort level with the. The other thing is, it's very easy to give this. It's not anything big or nasty tasting that the child has to swallow. For children, that's quite important. Children generally are quite happy to take these remedies. They seem to have an intuitive sense or feel that they're doing something positive. I have many parents report that the child will come up and ask for their remedies, particularly their daily remedies, but even seem to be ready when I tell them when they're ready for the next set of clears, as we call it. Once you're through the timeline of miasms, do you typically see complete recovery and absence of all symptoms? Well, this is a very difficult question. First of all, none of us are 100% healthy. You could have symptoms maybe at low level, you'd still get slight sneezy in the fall. I can't claim perfection through this treatment, but our experience generally is, yes, once you have gone through the timeline and you've gone through the chronic miasms. Now, you may have to go very deep. We have at least four levels, and even others beyond that. Generally speaking, in our experience, you could say the child is recovered. That doesn't mean all the health problems are gone. There may be some cases where there might be still some slight digestive issues. There might be still some learning issues, etc. But again, this is quite widespread. Many children have that, and it's a matter of keep working on that. And the deeper you go into the miasms, the better it gets. Now, once if you have some difficult cases where you've gone as far as you can, and where do you go then? Well, we have an approach using what we call a bioresonance technology called the core, which allows us to go deeper than we can with the miasms. Now, we can use this at any stage in treatment. If we get stuck or blocked and there's something hidden going on, it helps us to identify what that is. But in those few cases where even after having gone through the miasms, we still have certainly significant issues. They're light years from where they started, because they started in a bad place. But there's still something significant. We then use the core to work with that, and that definitely helps to move things forward as well. So every case is a bit different, but certainly the vast majority of cases is what you would call recovery. But I can't claim that recovery means they're 100% removal of symptoms. My son has been treated with Heilkunst homeopathy and is now doing a second round of miasms. Though he has seen many gains through treatment, a few specific autistic symptoms seem to be increasing regardless of further clears. Is this a common experience? Well, I wouldn't say it's common. What can happen, as I said, is you can have certain symptoms, new symptoms that can show up simply because as you bring up some of these underlying layers, they will temporarily exhibit some disturbance in the function. But a few specific autistic symptoms, generally, no, I wouldn't. That's the case, because when they do show up and they're persistent, we would then go after them with using the core, for example, or if we could repertorize on it, we'd find some specific remedies that would address that. Because usually when you have a persistent symptom like that, it's an indication that we're missing something. There's something in the background that is persisting and the body's trying to get rid of it, and it's exhibited by these symptoms. So we would normally focus on that and usually be able to get rid of them. So I wouldn't say that that is common, or it shouldn't be anyway, if it is. Okay, I don't see any more questions at this point. We've gone about almost an hour and a half, so sorry, an hour. I think we can stop it at this. Basically, again, just to emphasize that we don't have all the answers, but our approach is the most comprehensive one I've seen that I know of in getting at the deeper underlying problems in cases, particularly difficult cases. You can get lots of improvements using other techniques and therapies and approaches, whether it's chelation or diet or hyperbaric oxygen or other techniques and therapies. They definitely can be beneficial, but they can only go so far. If you don't get rid of those deeper underlying causes, then the problem will remain. And as soon as you go off the diet or you stop the therapy, stop the antibiotics, antifungals, or whatever, then the problem will come back. And so it's only by getting rid of deeper underlying causes that you really get a more permanent solution. And that's really what we're looking for. We do our best to acute to help in the short term, but our objective is really to get rid of these underlying fundamental problems and build up a strong foundation. Because once you have that foundation, then basically there may still be some issues, but they're relatively minor. You know, all kids have some issues, developmental issues, as they're going through at different stages. Things can pop up. Our treatment is not going to necessarily make you 100% healthy. It's definitely going to make you much stronger. It's going to create a stronger immune system. You're going to be more resistant to stress. You're going to be able to handle things better. You're going to be able to go through life and grow through life, as it were, as opposed to being stressed by it or being knocked back by it. And that's what life is intended to do. All of our experiences are intended to help us grow, as opposed to making us more fearful about life. But that's, in a sense, what this autistic condition is. It's a kind of fear about life. These children have a deep, deep underlying fear and often mistrust of the world around them. And they see the world very differently. We see the world through our eyes, and we're wondering why they're acting that way. But they look at the world in a very, very different way. But if you, because it's colored by their experiences, their traumatic experiences, but if you can remove those, including the so-called inherited ones, the chronic miasms, then definitely they engage life. They're much more positive about it. They're more open to life. And that then, when things arise, I do have cases that you hear from a year or two later, some acute situations, we deal with it, and then they move on. But that is normally the case. We can all have some issues that pop up every now and then, and it's just a matter of dealing with them. So I think I'll stop at this point. I hope you got some answers to these questions, and if there's enough interest in this, or if there are more questions down the road, we can certainly do this again. Well, thank you for coming, and I hope to talk to you, most of you or some of you at some point. Thank you.